One of the services we originally looked at to move closer to home was the anticoagulation INR service. And that service is aimed at people who are receiving Warfarin, and they need to have their bloods checked every week in order to ensure that they're clotting properly. And we've developed a number of different approaches to this. Some patients can have their anticoagulation service provided in the GP practice, and we've also developed something really exciting, which is a partnership with the Riverfront in Newport, which is more accessible for patients.
I'm Sam, I'm one of the anticoagulant nurses. Come and take a seat.
Previously I went to the Royal Gwent for my tests, which wasn't too convenient because of the parking and the queues of people usually. So it's far better here at the Riverfront. There's very little waiting time. At the most there were 3 of us, and I was here for about half an hour and out again. Much better.
So the patient now comes into the clinic, and where previously we would take blood from their arm, so we would need about 4.5 mils of blood. That would then be sent to the pathology lab where it was processed, so it would take sort of 24 hours before they got the result back. The patient can now come in. We've got a handheld machine called a QuagiCheck. We can just use a little needle, which is called a lancet, to take blood from their finger, and then we just have a small amount of blood that goes on a stick, and the machine will get a result straight away, and the patient will have the result here and now rather than having to wait for the results to come in through the post. So if they've got any problems, if they've had any change in medication, or they've had any bruising or bleeding, we can answer any questions they might have here rather than it be done on the phone as we previously did. They'll have their blood, some of them will then go on to town, some of them will go downstairs, and with the facilities we've got in the Riverfront, they'll have a coffee and catch up with other people that are on Warfarin that they've met in clinics.